Are you ready to embark on a journey of success? To discover your true potential in the untold stories of careers in life sciences? Welcome to PATHFINDER by the Purdue Institute of Inflammation, Immunology and Infectious Disease. With your host, Tommy Soares, discover the untold stories of industry scientists and unveil the secrets to excelling in your career. Thank you for joining us once again, and remember to hit the like button and subscribe to our channel. Welcome, everybody. My name is Tommy Soares. I'm Director of Scientific Strategy and Relations for the Purdue Institute of Inflammation, Immunology and Infectious Disease. And today I have the pleasure of welcoming to our Pathfinder show, Kenny Yeh, who is the Senior Director of Business Development at MRIGlobal. I asked Kenny to write a little intro for himself, and this is what he wrote. I lead our teams to devise solutions for our clients. I have roles as a scientist and advisor, also functionally as a driver and facilitator to reinforce our core capabilities and partnerships. What excites me in my awesome job are the opportunities for creativity and exploration, whether that is addressing molecular detection in the field or building partnerships across the U.S. government and commercial partners to address challenges in biodefense and global health security. Welcome, Kenny. Welcome. Thank you so much for being part of the program. I am so excited to speak to you today.
Likewise. Thank you, Tommy. Yeah, I appreciate your warm intro, and thanks for reaching out. I did get a chance to see some of your earlier interviews, and it's quite an overall program. And I'm very honored to be included among the distinguished speakers.
I got to tell you, the honor is all mine, Kenny. I've been following your work for some time. In fact, I learned about MRIGlobal during the pandemic because I was like, there were a lot of people asking me, do we know anybody who can do some of the testing, antiviral testing, and some of the surface contact testing? And so, you know, the voice kept coming back, and people kept saying, oh, you have to go to MRIGlobal. You got to talk to them. So I am so excited to hear a little bit about your career trajectory and obviously what you do today and MRIGlobal and what do you guys have going, because it's so exciting for somebody like me in the field to be able to get an inside look into you and your career. So I'll invite you to take us back as far as you want to take us back. And as we typically do, we'll give you the spotlight and take the stage here.
Sure. Thanks, Tommy. Yeah, I'll just start. My current position, I'm a senior director at MRIGlobal. It's the Midwest Research Institute. It's an independent, as you can imagine, research institute, and I'm actually part of a business and program development team. So I'll work backwards because this is sort of a long road to get to sort of this particular position. And I'll try and kind of make this relevant and interesting as I can. Okay. So I grew up in the state of Maryland in the Washington, D.C. area. And I mentioned just a few schools that I attended. So when I entered college, I actually went to the University of Maryland, Baltimore County. Okay, go Retrievers. And really, it started as I had the opportunity to study engineering and also participate as a walk-on athlete on a cross-country and track team. So it was kind of those, hey, let's try those out. I got through 2 years, okay, and decided, okay, one, I had to switch my major. Different, just both of those activities I mentioned are very demanding to try and do alone, let alone try and combine. So my sophomore year, I took an elective class in microbiology. And I've always had an interest in biology, life sciences, and maybe this is from kind of the natural sciences, the environment, just sort of that, maybe that romantic, like, oh, let's be a wildlife biologist type of interest. And so and really, microbiology sort of, I really had no, the content, the subject matter was a little different, but there's a hands-on component to it. You really have to be good with your hands. There's a lot of, keeping busy, you're learning laboratory methods and techniques. And so there's a component to that, and maybe that sort of edges on kind of like maybe a little art. So um, that was interesting to me, and I was pretty good at it. I enjoyed it, and it was a very good kind of learning. So anyway, um, in trying to sort, I was at kind of a smaller branch campus, the main campus at University of Maryland. So Big Ten now, so we're all friends and family, right?
Yeah.
So they had a microbiology department, and again, going back in time, okay, this is pre-internet, so pretty much anything hard copy, you're just grabbing your hands on. All right, I went through the course catalog. I was like, wow, this is very interesting. Microbiology, it's all very specific. Okay. I looked at the curriculum and I was like, wow, I can still get out in 4 years. So let's do it. Um, I went over there. When I was getting acquainted with the campus, I was looking for some part-time work. And again, everything's in front of you. And, Associated Campus, and everyone knows there's a lot of posters up for various programs, and then kind of your help wanted. Well, there was a help wanted there, and took the phone number, but it was like, oh, you know what? This person, maybe they're in the office right now. I'll just take the extra few minutes and go up there. We had a discussion. They were looking for just a research lab technician. Kelly really had to sell me in a position. She's like, hey, we have some lab stuff to do first, but would you be interested in doing a literature review, literature search? Visit the libraries. Again, I'm dating myself, but here's a card copier. And I was like, yeah, I can do that. This is, stuff you can fit 30 minutes, you can fit in a block of hours. Anyway, so she set me loose, and this was a marine estuarine laboratory. So if folks are familiar with the study of Vibrio cholera, this is actually one of Rita Colwell's several labs.
Yes.
So I knew right away, wow, I can get some exposure to, some, world-class research. So I took that. Again, this is before the internet. Like, the information is so, wow, you really got to dig around for it. And it was actually a very good exercise because, I have a list of references. You're doing a scavenger hunt. You're not going to find everything.
Yes.
At the end of the day, you have to come back and say, look, these are the best ones I found. And from perusing them, I think these are pretty good. There are a couple, you always had the subscription ones, the ones you got to translate into some language, that's going to be a reach. And then I'll point out, this was, if folks remember the old microfiche, so it was this little microfilm, and it was a lot of staring into this sort of projector, looking, this is before like PDFs, but anyways, so, and I got experience, really it kind of boils down to detection of bacteria in the environment. So really it was the exposure of doing a lot of field work. So it wasn't necessarily in sort of your conventional laboratory. Okay. And when I finished, I really got an interest in going to graduate school because after doing a preliminary job search, I found, it wasn't going as fast. I wasn't well equipped, as far as building networks, experience, and so on. So concurrently, I filled out some job applications. And again, this is sort of, seeding opportunities. I was actually interested in like the study of nosocomial infections, sort of that it's under maybe like hospital control, and infectious disease, and then public health. I was actually going to go study at a Master's of Science Public Health degree. And so this was summertime, and I reached back out to the school because I had not heard back. And I'm basically dialing a number that's being unanswered. Somehow, someone in their staff reached back out to me. They found me the next week and like, Kenny, we're so sorry. We just moved our office. Everything's totally up in the air. We're now catching up, and I'm reaching out to you to tell you that you've been accepted to the program. Okay. This is like mid-June, and I'm like, wow, I need to figure out a plan, because this is in reality, it's, wow, do I continue living with the parents, or can I come up with some other program to get in the fall? So a best friend of mine, he actually asked me, hey, would you mind making a trip down to South Carolina with me? My wife's graduating, and I just need someone to help look for a place. And so I was like, sure, I'm not doing anything Wednesday. And oh, by the way, I should probably grab an application. And we drove down early one morning. I walked into the office, and I just introduced myself to the receptionist there. And she happened to say, hey, if you would like to meet the department chairman, he's actually having lunch. So we actually had a very nice conversation. He was interested in my work, and he pretty much accepted me on the spot. Awesome. With an assistantship. So yeah, so I did some work there, and this is actually at Clemson University in South Carolina. Yeah. And from there, it was really reinforcing skills I'd learned studying microbiology, cell culture. My first job out of school, I was hired as a microbiologist out at the Dugway Proving Ground. It's in the middle of the West Desert in Utah. There was that old saying, like, go west, young man. And I'm like, let's see a different part of the country, the world, and have that experience. It's a remote location, very kind of niche-y, interesting work. But the Dugway Proving Ground is actually it's a biodefense lab. And this is really, there's a lot of land area out there. They do a lot of aerosol testing with simulants. So you can drop a cloud of bacteria, a bacteria simulant, or viral, or a protein simulant. And they have a particular grid that they will set up with a network of sensors and sort of measure how it dissipates and what is being collected. Okay, so I call it R&T, so it's research and testing. Okay. So I got some very good experience. The lab is staffed by civilians there. It's managed by the Army. Okay. Okay, and that experience included biosafety level 3, so high containment. So I spent 3 years actually growing anthrax. And this was in the mid-90s, so sort of before this was a household name, and maybe folks only know it from the heavy metal band. But yeah, so you get that, Tommy. Yes. Yeah, and so while I was there, there's two components. They do a lot of aerosol testing, as I mentioned. Yeah. And then I was in the biotech branch, which really supports a lot of the assay and measurement. So if they do a particular exercise out in the field, they bring the samples back, and then we test them. And the tests we typically did were kind of your immunoassay, 96 well plate, just sort of your basic ELISA. Mm-hmm. And folks have, when you work with that type of test, there's always this question on specificity. Mm-hmm. And it was like, wow, this, what we're trying to detect is a common, bacillus soil organism. And it's like, there's got to be a better way. I mean, this is just, half the stuff we run, it's just like, what is this really telling us? Right. And one of the scientists that came in, he had a molecular biogenetics background, and he sort of had brought in PCR. And so I recognized that as, wow, that's really, I somehow need to get a handle on that type of test. And he more or less gave me an opportunity to kind of learn that, from a kid, because my last year in college, I chose to take immunology over genetics, just basically by preference. But who know, life is full of full circles, and you
Yes.
come back and learn a different technique that's now a household term,
Yeah.
PCR. Yeah. So from there, 3 years in, and probably folks in that position, the technology is very close to you. I think maybe there's sort of a you kind of want to keep things moving. And I say that now because my kids are grown up and they're in college now, so they're sort of in that kind of same mode as well. So I joined a couple. At the time, there were smaller biotech companies in Salt Lake City. One of them is called Myriad.
Mhm.
I pretty much learned a lot of the PCR and some of the Sanger sequencing from there. And then I came back around to a company called Idaho Technology. They are now BioFire Defense. They're owned by bioMérieux. And that was really a very interesting reinforcement of pretty much everything I studied, biodefense, detection in the field,
Mm.
and so on.
That is so cool. And do you, I mean, was there anything at the beginning that you can think of that was uh, inspirational about microbiology? My gosh, it seems like from a very early stage, very early age, you knew that microbiology was it for you. There was something about it that could you envision it? Could you see the microbes in your head?
Yeah, no, that's a good question. I definitely have sort of, maybe kind of that visual mindset.
Yeah.
I I didn't really, because I always equated, um, maybe I mentioned that sort of like naturalist or wildlife biologist, but it's always you go out in the field or the forest, and it's everything you see. And microbiology, it's everything is under a microscope, and or
Yeah.
some rendering or drawing. You have to use your imagination. So it was much more abstract. But I think as an overall ecosystem, um, I got it, because it's there's, for example, there are many microbes that are pathogens.
Yes.
Obviously some more than others, some aren't, but then others, given the opportunity, can become, pathogens. So it was really I don't know, in my mind, that's kind of how it, like, the world was shaped.
And was there any inspiration that caught your attention or anything that you can think of that early on you're like, man, I wanna do that. I wanna study that.
Yeah, well, definitely, partly my parents. So they kind of encouraged me in the science. My father definitely, he he kind of thought it was, having that technical background and acquiring maybe those quantitative skills. So with the examples I mentioned, okay, so went to college as kind of like a walk-on athlete, and then studying engineering. So I was
Yeah.
comfortable. I liked the challenges, and I was comfortable with things like being hard.
Yeah.
And that, I think, that was partly came from two things. One, I'm just, I have a lot of interests, one. And then two, I was always afraid, well, if I went into something that's very, or seems like an easy or natural reach, and if I'm already pretty good at it, like, am I going to get bored of it later on?
Mhm. Mhm.
But to answer your question, there were a couple inspirations, but they came differently. And I'll use the examples. When I transferred schools, I was really having a discussion with kind of the advisor you're assigned to, and we're trying to figure things out. And he pretty much said, "Yeah, you got to figure out something, or you have a fifth year, because the way the curriculum's situated, we don't offer certain classes in the summer, so you just tacked on an extra year."
Mm.
And his last comment was, "Yeah, this looks pretty fruitless." And I sort of walked out of there and I was like, okay,
Oh,
whatever. But I actually have another thought in mind. And so I executed that. So I think, part of it is learning at an early age. Okay, sort of that saying, being comfortable, uncomfortable, sort of embracing a challenge.
yep.
And really it's like, oh, you can't do that. And that it really resonates. It's like, well, what do you mean I can't do that?
Right.
There's a
Right.
compliance thing, there's a permission thing, but you were saying like you think I'm whatever, my skills or capabilities are limited.
Yeah.
I can't do that. Well, let me show you different. So I
Yeah.
think that kind of provided inspiration.
Kenny, you say that, and it's incredible how sometimes pain and negative thoughts or whatever are what drives us to do our greatest work and to disprove others or to show them that we could. I think I've had similar instances in my life where people have said, "Oh, you're not good enough for that," and you're like, "Oh, really? I'll show you." But that's incredible. I am very interested though in, you got the courage to go up to the office of the program director and be like, "Hey, I'm here. Hi. What did it take? What were you thinking? I'm sure you were a little nervous and had the butterflies before going up there, but like, what was that all about that you said, "Oh, I better take this opportunity and run with it"?
Yeah, I think it was, just sort of being proactive. I go back to the example, there's a job posting and they cut the little things, there's a phone number, and it's like, well, I'll do one better. I'll just go straight to the office. If the person's not there, I can always do the call, but
Right.
I think it just expresses interest. You're gonna know right away, right? I mean,
Yeah.
hey, maybe it's again on the contrary, it could be an opposite, but really it's just taking that small opportunity. I know it's hard because you sort of sometimes you introduce yourself off blind. And really when I walked into the Department of Microbiology office, I knew it was lunch hour, and I was merely going to ask the receptionist, hey, is there an office hour? I was thinking ahead between the next 2 days, can I come back?
Yeah.
And she just happened, oh, and there was no one else there. So
Yeah.
I think we just had a very nice conversation, just getting acquainted. And I had my, just sort of a resume in front so he could quickly scan it.
Sure.
Um, so yeah, it's maybe those kind of being at the right place at the right time, but it was, yeah, I think you fully have to expect like, okay, well, meeting someone is good.
Yeah.
It's better than a call. It's, nowadays it's better than an email, that type of thing, but
Yeah.
really having that conversation.
But I really like that because, we don't always stick our necks out to make those opportunities become a reality. And you did. You said, "I'm not going to wait. I'm not going to just send an email. I am not going to just take the phone number and have a phone call, but I know that if I go there, at least I might have the opportunity of introducing myself in person." That is such a valuable thing to do because you created that opportunity for yourself. Um, and so, okay, so you're at Clemson now. The experience must have been awesome enough to keep you going and keep you motivated to keep going in this area. What was that transition like from Clemson to Utah? You described it as your first job as a sales position in it. Was it in Myriad? Was that the one? Oh no,
Yeah,
the Army Proving Ground.
yep. My first job, so
Yeah.
I was very much still in research, if not
Yes.
research and development. So, yeah, to answer your question, so yeah, graduate school, is dating back to that first, hey, can you a graduate student is asking me to help her with a literature review, right? So you're really getting grounded. Okay, so
Yes.
you're kind of building, sort of that library, and then acquiring those skills. When I'm in graduate school, you're working on small studies, you're acquiring those skills, and then yeah, I that first job out of school was very exciting to be in this real kind of nichey,
Yeah.
um, almost world, and who works with Bacillus anthracis and so on.
Right.
And then really the question was, how do you detect a potential biological warfare agent in the field?
Mhm.
Okay, when a soldier or warfighter gets sick, that's too late.
Yeah.
Okay, we have to, there's a whole kind of logistics and being proactive, and that I get that. That was part of my experience. That's part of kind of the doctrine is sort of kind of what we're um, sort of brought up. But
Mhm.
yeah, I think that interest and really the interest in helping people,
Yeah.
protecting them, ensuring they're safe.
Yeah.
And so the yeah, I call the work research and testing, research and development.
Yeah.
It's a very good experience. I would highly recommend it, even if especially if it's to like a product.
Mhm.
Because I think that's a very, um, it's proof positive.
Yeah.
You know, your customer is going to tell you, of course, it's your work, so you can admire it from all kinds of views, but your customer's going to tell you, hey, this works, or this is a flaw, that type of thing.
Yeah.
And so starting at the time as a small company, and having a technical background, so I was really um, wearing a lot of hats, and I got an opportunity to support the director of corporate development at the time. It was basically to show a demo, and then that sort of led into sort of like a training kind of product development, and into kind of sales and marketing, and then business development. Business development is it's a big squishy word.
Mhm.
There's a lot to it, and I can get to it later. But really, a lot of that is, I think it's personality. You have to be comfortable talking to people. A good example, I think my kids, while they were in school, they were like, one day they're like, oh, we're very much we're introverts. I was like, yeah, yeah, I get that. There's sort of, introvert, extrovert. And I was like, yeah, by nature, yeah, I could, probably like that. But, I think the term I use is ambivert. Okay, okay. So I think part of the work is, yeah, yeah, you have to talk, you have to make your point when
Yeah.
available, but you also have to be a very good listener.
Yeah. Yeah. It's so true, and you have to be able to really capture the what is happening from that other side, because your thoughts are going to take over, and you're going to stop listening after some time. It's incredible though, this trajectory, and what an inspiration though, to find meaning in doing the work that you're doing to keep people safe, and to care for their safety and security, even at a distance. As you said, once they get sick, it's too late. And to have that responsibility that this better work, remotely or as far away as we can, so that we can keep people safe in that respect. What was the work? And I will say, I know you say, oh, the internet was not what it was, and I agree. But when you went to the library, you had at least a Unix station where you could look up, what was it, PubMed, and yeah, the Library of Medicine publications. So it wasn't that bad. You use Telnet for your email, but I would say that, what's incredible is that transition as we've gone. I mean, the technology has gotten better and so on, but some of the basics of microbiology have been in focus, in development. And as you said, being introduced to the PCR technique and perhaps even to sequencing and all the bioinformatic approaches at Myriad was an eye-opener for you too. And it must have given you a leg up, knowing all of the cell culture piece that you already had under you, and now being able to dig down into the molecular landscape and be able to like understand, okay, who's there and who's attacking who, because it's a warfare, isn't it, between the microbes?
Yeah, I think it's just sort of the technological evolution. I think biotech, life sciences, I mean, the growth is, at a very high rate right now. We obviously lived it in the pandemic and kind of demonstrated biotech is kind of the bioeconomy. So, I would say, in my current position, I joined MRIGlobal, and we a lot of the work we do, we make our partners' products better. We're known as kind of a test and evaluator. Okay, and if you think of the organization, the institute was built upon like high containment facilities, for example, that can house agents and chemicals.
Sure.
So the but that sort of work, um, it's a little bit different from a product. So product generally, there's a product family or a few things. You're very hyper focused, especially as a startup. You can't have a dozen focuses. You won't survive.
Right.
But we're in a unique position because we have a view to all sorts of technologies, all sorts of projects, customers. So I guess for me, with different experiences and what you just sort of noted, it's very, in my mind, you can make those connections very
Yeah.
fast.
So, what was there a big transition from Myriad to MRI? I know you also put here you had 5 years as a technical sales manager at BioFire as well. What was that time like as a technical sales manager, even there? And you also talk about Sabre Technical Services as well. What was
Yeah,
that time in your life, and how did it prepare you for your current position at MRI
yeah,
Global?
definitely. It was definitely, um, probably a foray, kind of springboard. So what I'll tell you is, starting with the work at Idaho Technologies. So this is the late '90s. Okay, our
Mhm.
client was U.S. military, collaborator with the U.S. Air Force. So they were charged with, hey, we have this challenge. We want to, in short, we want to take the the best current laboratory diagnostic technology and take it out in the field.
Mm,
Okay, so in short, there are many challenges, right? You have the environment, right? You have to put it in sort of something beyond like a padded case or Pelican case.
right.
Um, you have power limitations. You
Yeah.
have cold storage, which
Yeah.
is often a non-starter.
Yeah.
Okay,
I,
and
I
then
always also think about all the shaking and vibrations in the car ride or the truck ride there.
yeah, so so we work very closely with um the customer, and also we had a different end user. Okay, and this is very important because not everyone is a professional scientist per se. Okay, so we're dealing with a user group that, okay, they can perform maintenance, they can perform a test and report the results. Okay, and it's not to say they're not a scientist, it's just their duties. This is one of several duties, if I use
Sure.
sort of almost like a first responder.
Yeah.
So we really had to adapt that product to address that. So in short, that included, okay, we are developing assays to detect plague, tularemia, anthrax. We are putting this in a freeze-dried or lyophilized format, which, think of very small volumes. And now this is very common now, especially for
Sure.
molecular grade reagents.
Yep.
And then providing an interface. Okay, and this is obviously now much easier to do. Okay, so we were kind of well set, this is the late 90s. Okay, and then so September 11, 2001, um, you know, obviously, yeah, just a terrible, tragic day. A month later, we're getting a lot of discussions, calls, okay, and we happened to be in New York City supporting a client when that city's first anthrax letter was hit. So we were really kind of in a response mode for supporting several clients there, okay, who have really not done this in a real kind of event.
Right.
Okay.
Right.
So yeah, and that is very important. I sort of think of, wow, we've come along in 2001, and then the pandemic, sort of
Sure.
two
Sure.
different instances, obviously on scale. So anyways, from that experience, yeah, again, we're small companies, so I'm charged with kind of technical sales. I think for a small company, it affords us to be very, agile and nimble, because the same person, yeah, I'm the sales manager, but I can also discuss the operations and
Yeah.
some of the technical aspects before bringing in, another expert.
Mhm.
Um, from there, I got interested in some of this other work. And, so you have sort of a bioterrorism event, and then you had the Gulf War. So I was introduced to folks at United Nations. So, and actually, I trained with their weapons inspections team. And again, this was to put, hey, we need a detection identification field kind of in the field, and they're sort of monitoring and verification. If they collect a sample, they want to get a presumptive result in the field before it's sent to a reference lab.
Mhm.
Okay, and that was very interesting work. I mean, this is, now you're on sort of a national security, or sort of a global level. So it was probably from that experience, and you mentioned some work at Sabre Technical, which was kind of more on the decontamination.
Mm.
But they were also a small company, and they were supporting some work in the former Soviet Union. So I got acquainted with a DoD program looking at research and biosafety, biosecurity.
Mhm.
And really, that's what brought me to MRIGlobal. I When I joined, there's a program called the Biothreat Reduction Program. They needed someone, ideally with a technical background that could manage several projects. So this is managing the projects, managing the U.S. collaborators. We had some collaborators in UK with
Mhm.
partner country scientists in Kazakhstan. So a very multicultural, um, and kind of scientific kind of management. And so that was very interesting work. It's very interesting from the manager perspective. And I would say any meeting we had, like the second we could have a technical discussion, I would call it a success, because usually it's the front end of some logistics, or, but it was a very good experience, because you having done some of that work before, but you sort of had to, okay, well, I'm kind of the manager, not the
Right.
collaborator. Yeah. And yeah, from there, that when that work had kind of tied up, yeah, my boss at the time, he recognized my earlier work that you've already mentioned. He's like, hey, let's sort of, how can we encourage our folks, and he kind of spouted kind of this program development, and I kind of equate it. So I mentioned work in industry as a product development. You have products, families of products, the whole kind of cradle to grave sort of life cycle. But now we're dealing with expertise, so programs. So it's growing, our health surveillance team, our diagnostics team, and so on, and we're really growing that. And yeah, my other good colleague, he calls it's that match game with cards. Okay, but or speed dating, I guess you could
Yeah.
call it. But really, it's hey, encouraging folks, hey, get out there. You should really promote all the good work you're doing where you can. And it's really, hey, how can we grow the business to work with other people and make those appropriate introductions and do this kind of long term.
Are there any favorite parts of your job that you do now that you want to tell us about? And then I'll ask you a last question about, like, if people want to start doing work that is relevant to biodefense, what would be good ways to start thinking about this? I know there's a lot of the audience that is international as well, and I know that there are a lot of people that might be interested in doing this type of work. But yeah, tell us a little bit about what's the favorite things that you get to do still today?
Yeah, I would say a couple. So sort of my kind of day-to-day work, and business development has, there's a lot of things. There's kind of a sales component, there's a marketing component. I think what really excites me, is kind of mentioned, is really creating those partnerships and really creating those teams, right? So hey, there's a particular problem here,
Yeah.
and it's almost like just sketching it out.
Mhm.
You need this capability or this person or this company, and really just sort of mapping it out, right? And really, like, hey, this could be the team. This is like, trying to creating the dream team is always very exciting. And I think the
Yes.
past work I was involved in, at Idaho Tech with Jay Bades, we're performing a DARPA project for detection using CRISPR-based diagnostics. It's very much the um, yeah, sort of that same very organic, getting able, willing, and interested. That's
Yeah.
what excites me. I Marketing is also a broad term. I like the marketing aspect for the creativity. Um, I think of the opportunity to work with our marketing team, creating a backdrop, creating collateral. You get to a conference, it's like, this is an opportunity, like, how can we kind of stick out? Okay, make it interesting. Okay, so it's sort of this just kind of a standard conformity. But there's always companies out there, there's something unique. It's either who they brought in the booth, or they have a cool giveaway, or there's some kind of presentation. But to me, that's very interesting. And a lot of times there's not necessarily like a right or wrong answer, and some of these things have been tried before. It's not like it's something totally um yeah
Yeah.
new. So and I think really and kind of that mentoring, kind of coaching, whether it's
Yeah.
sort of sales and marketing, or someone as a scientist, hey, like there's that natural, like, have an idea, and someone will respond, well, you have 3 reasons why you can't do it. And it's like, well, okay, I get that. Okay, getting in front of a talk, to me, it's not very natural. When you're practice, you're in it. When the salesman, you can give that elevator speech, but when you come off practice, it's harder to get into it. But it's really, hey, you should really embrace that as an opportunity, right? So
Yeah.
the we all live kind of the Zoom thing, and then when we were starting to congregate, more publicly, there was definitely, I had to go through a curve to like give like a presentation. I was like, wow, I actually need a couple practice rounds. Just, you kind of want
Yes.
to know where the screen is.
Yes,
Yeah,
totally. Absolutely.
yeah,
No, and I love the that you find so many different aspects that are so interesting, especially as you've gone from a scientist now to do more of this business development piece. And I'm sure that, so did you learn as you went along, or did you take courses? Or, I mean, how does somebody get to be where you are today if they wanted to start?
Yeah, really good question. And I think, and to answer your second part of the question, so, you know, um, maybe I have this kind of this niche in biodefense or biosecurity, right? So I don't know if it's kind of like a discipline, it's an application.
Yeah.
And now it's, folks interested, take a look at global health security, right? There's sort of this intersection of health security.
Mhm.
Um, I think, I think my mindset was being very active. Okay. Um, this was, I think, um, talking to people, partnerships, because if you can create something and sort of grow it, seed it, build it, there's something to be said for that, obviously. And I get, yeah, a lot of this is probably on your own time. I think participating in workshops, seminars, um, the the trainings are really good. I think I was always sort of in kind of a job where, yeah, it was kind of hard to fit that in. But then when I look at it, it's like, you know what, it's the work I'm doing is kind of on the job training, and it's not to place the training. It's just I sort of took that approach, like, well, this is sort of a training for, whether you're doing a market study or meeting a customer or going back to the lit review, learning about something like the bioeconomy.
Yeah.
And yeah, and I think this is something, a product of my work that maybe came later, but really like, oh, some of this work we did, some of the work we did in Kazakhstan,
Mm.
it's not well published. If you look it up, it's not kind of there. Well, could we get some collaborators? Could we at least publish our work, even if it's sort of a perspective? And that's just sort of a starting point, but something you can just sort of build around that.
Mhm.
And it's, again, it's hard, it's challenging, it's, yeah. But I think, and for me, the one thing I didn't mention, dating back to probably my undergraduate days, I got a very good hands-on experience. But I would say the two things I probably, when I came out of school, not real strong on: the technical writing and sort of presentations.
Mm.
Um, Again, it wasn't necessarily a requirement. And even when you're assigned, you are not getting heavily critiqued, right? It's not like a sales presentation where, hey, we're going to record it. We're going to, walk through it, and it gets, yeah,
Yeah,
it's
that's
coaching nuances, right? It's like,
yeah.
a technique or like an athletic practice. Like, no, quit doing this particular thing. Or
Right, right. Oh, that's so true, and so wonderful that you mentioned. And I give that same advice to a lot of the students too, saying, "Hey, record yourself when you're giving your presentation, and look at yourself, critique yourself as you're presenting, as if you were a third person." Kenny, are there any questions that I didn't ask you? What would you like to leave as your parting message to our viewers of our Pathfinder? And really, it's been wonderful conversation so far. You've opened up my eyes to quite a few things. I'm going to have to look a few things up too.
yeah, well, we're happy to, yeah, have a future conversation for sure. Yeah, I think overall, just for, folks, especially students and folks, you know, entering the full-time career market or even considering a career, it's just, really take a look at those opportunities, and really take a look at what your interests are. Like, there's something to be said about, a particular desire, and whether that, you're at the right place at the right time, or, hey, I really have an interest to work for your company or do your kind of work. Can we start a conversation that way? And, I think a lot of it is, coming into ideas, and a lot of, the business development is, you kind of start seeing things. Oh, this work is being done, but there's also a little niche that's not being addressed. Okay. And the whole thing is like, well, who can get there first?
Yes.
And then that's exciting. But yeah, I would say, folks out there, yeah, like do your homework, just get out and meet people. And really, and this is something I told my daughter, she just finished school and got her first job. I was like, look, part of it is, talk to people, but really, you need to demonstrate also what you can do. So maybe there's that experience, when you're early in your career, okay, despite your wish list, it's not about you. Okay. But really it's, hey, what can you offer? What can you demonstrate? That's one kind of an exercise, but it shows, wow, this person is very interested, they're responsible, and so on. I think that's part of it, back to partnerships. It's really important. Like, well, what can I bring?
Yeah.
How can we like make this, a synergy?
Yeah, have a great positive attitude. Well, thank you. Thank you so much. Parting words, did you want to say something?
I'll leave it at that. No, thank you.
Okay.
I really
Thank
appreciate the
you.
opportunity and being part of your program. Thanks so much, Tommy.
Yeah, thank you, Dr. Kenny Ye, who's the Senior Director of Business Development at MRIGlobal. Thank you for being our Pathfinder today, and I hope you have a great rest of your day.
You too. Thanks, Tommy.
Okay, bye-bye. Thank you for joining us once again, and remember to hit the like button and subscribe to our channel.